So this is my disclosure slide. Okay. So why do we need AI for pancreatic cancer? A simple answer is that early pancreatic cancers are obscure or even invisible to our human vision. So pancreatic cancer is the most lethal cancer. It is now the 7th leading cause of cancer deaths in Taiwan, and is projected to be the 2nd leading cause of cancer deaths in the US by 2030. The overall 5-year survival rate is only 10%. And the early detection is especially important for pancreatic cancer, because if we can detect the cancer when it is smaller than 2 centimeters, with current treatment, the cure rate is 80%. However, once the tumor grows beyond 2 centimeters, the survival rate drops to below 20%. However, it's not easy to detect cancers that are smaller than 2 centimeters. For example, the right panel is a case who presented with a dilated bile duct and was confirmed to have pancreatic cancer after surgery. But there is no apparent mass on the CT scan in the pancreas. And it is not a rare event. Studies show that approximately 40% of pancreatic cancers less than 2 centimeters are missed on CT, the major detection modality for pancreatic cancer. So very often we see patients like the left panel who presented with symptoms or imaging findings suggestive of pancreatic cancer, but without a visible pancreas mass. So in such cases, it's very often for the patient and the doctor to opt for follow-up only, and very often leads to delayed diagnosis and poor prognosis. Furthermore, very often, benign pancreas disease can look very similar to pancreatic cancer. Sometimes they are indistinguishable to the naked eye, and a delayed or incorrect diagnosis and treatment for pancreatic disease often lead to catastrophic consequences. So we think an effective computer-aided detection diagnosis tool for pancreatic cancer is urgently needed. We need such a tool to improve the sensitivity for early pancreatic cancer, to enhance diagnostic efficiency, to offer timely treatment for the patients with early pancreatic cancer. So a few years back, the AI has shown promise in medical image analysis, especially with the convolutional neural networks, which are models that simulate our brain structure. And with a lot of data used for training, they can learn how to do classifications. So after seeing a few studies that show these models can help diagnose like retinal diseases or skin diseases on images. So we wondered if such models can help us distinguish pancreatic cancer from normal pancreas. And more importantly, can it capture subtle or even invisible imaging characteristics to help us detect early pancreatic cancer? So we use data from our hospital to construct a training set and 2 local test sets. And also we use some public available US data to use as a test set to know the generalizability of the trained model. Okay, so this is the analytic workflow. So we, during the training phase, divide the pancreas into various patches. And for those patches that contain the cancer, we call them cancerous patches. And the non-cancerous patches do not contain the cancerous part. And then we train a CNN that can distinguish pancreatic cancer from non-pancreas cancer patches. Then in the testing phase, we divide the pancreas into patches, and then we put every patch into the model. And then based on the patches of all the patches in a patient, we classify a patient as having pancreatic cancer or not. So in the pre-processing phase, we have experienced the radiologists to label the pancreas and the tumor manually This is very labor intensive. And then the images are normalized and then cropped into patches. Then in the patch-based analysis, the CNN is trained to classify the patches into cancer or non-cancerous patches. And then in the patient-based analysis, patients are classified as with or without pancreatic cancer. So here is the result. So the final model consists of 6 convolutional layers grouped in 3 groups. So we can see that in both local test sets, the sensitivity and specificity is approximately 99%. And we further compared the sensitivity of the trained model with the radiologists in our hospital. So we found that the CNN achieved higher sensitivity compared with radiologists by a difference of 5 percentage points, which reached statistical significance. Notably, the CNN model identified 11 of the 12 pancreatic cancers that were not detected by the radiologists. So here are 2 examples. The left one, the patient presented with acute abdominal pain and the characteristic image findings of acute pancreatitis. But later, a few months later, it turned out to be a pancreatic cancer that caused the acute pancreatitis. The model was able to correctly diagnose this as cancer. And the right one is what we have seen previously. Okay, and then we analyzed the sensitivity according to the tumor size. For tumors less than 2 centimeters, the CNN achieved 92% sensitivity. And for tumors larger than 2 centimeters, the sensitivity is 100%. So this is the right side shows the heat map according to the probability of cancer according to the CNN model. And you can see that the tumor location according to the model corresponds very well with the true tumor location according to radiologist. So it supports that the trained model indeed see the tumor. Okay, so we in 2020 published the first AI model that can detect pancreatic cancer and even those that are invisible to the human eyes. So, but as one of the previous speakers touched upon, so these deep learning models are often criticized for their lack of transparency, like a black box. So instead, radiomics converts the imaging data into high-dimensional data for subsequent analysis and data mining. So from these images, radiomics can extract features including first-order statistics, which basically reflects the intensity of the voxels, and also second-order statistics, which reflects the texture of the images, and also other higher-order statistics, which apply various filters and mathematical transformations. So we wondered whether there are certain radiomic characteristics of pancreatic cancer, and if we can identify a set of useful features that can help us detect and diagnose pancreatic cancer. And we also wonder whether these features are generalizable to external data. So this is the workflow, which also very similar as the previous deep learning study. So the only difference is that after the pancreas is processed into patches, then we extract radiomic features and then train a model to determine whether a patch has cancer or not based on these radiomic features. So again, we use data from the National Taiwan University Hospital to train the model and to test the model. And then we also use publicly available US data as external data set, external test set. So this illustrates the patch generation. You can see that there's a, Okay, this is the cancer, probably easier with the mouse. And these are the dilated pancreatic duct secondary to the cancer in the head. So you can see that the cancerous patches tend to be darker and more heterogeneous compared with the non-cancerous patches. So we compared the radiomic features between pancreatic cancer and the normal pancreas. And we found that certain features show the similar trend between Taiwanese and the US datasets. And if you use t-SNE to visualize the data, you can see that the cancerous and the non-cancerous patches actually can be classified into different clusters. So that gives us more confidence that we may be able to use radiomics features to diagnose pancreatic cancer. So then we use a machine learning classifier, the XGBoost, to analyze these features. And we noted that there are certain distinguishing features, and some of them that reflects the density of the image tend to decrease in pancreatic cancer. And this is consistent with the imaging finding that pancreatic cancers look darker compared with the normal pancreas. On the other hand, features that reflect heterogeneity tends to increase in pancreatic cancer. And this is also consistent with what we see on images, that pancreatic cancer are more heterogeneous compared with the normal counterpart. Right, so use this trained model, we can achieve an accuracy about 90% in classifying patients with versus without pancreatic cancer. And in the external test set, we found that the accuracy dropped by about 10 percentage points. But it is interesting to note that if we add a little bit of external data to train the model, then the new model can perform much better in external data, although the performance in the local data set is still pretty much the same. So we also looked at the sensitivity by tumor size. For tumor less than 2 centimeters, the accuracy is about 90%. And for tumors larger than 2 centimeters, we can achieve 95% sensitivity. So again, this is a heat map according to the probability of cancer predicted by the model. And you can see that the predicted tumor location corresponded very well with the actual tumor location. So I think these results are promising, but it is far from clinical application, because to use these two models, the radiologist needs to label where the pancreas is on the image. It's very labor-intensive, time-consuming. No doctors would want to use that. So in order to use it in the clinic, we have to do data preprocessing and to do an end-to-end automatic analysis workflow. And we need to have a user interface. And last but not least, it has to be robust to variations in patient factor, imaging parameters, and various patient factors, and must be generalizable to external data. It is very common to see AI models that the performance drops significantly when tested with external data. So we made an end-to-end workflow consisting of preprocessing and then use deep learning to identify the pancreas on the image. And then we use multiple deep learning classification modules to vote and determine if the patient has pancreatic cancer or not, and indicate the location of the tumor. And then we conducted a nationwide population-based study using data, real-world data from across Taiwan to validate this device. So this represents the upper row is a cancer in the head, middle row is cancer in the body, and the lower row is cancer in the tail of the pancreas. And this is the original image. This is the tumor according to radiologist assessment. And this is the tumor according to AI prediction. You can see that they correspond very well. So in the nationwide test set, the device can achieve an accuracy greater than 90%. And for tumor size less than 2 centimeters, the sensitivity in the local test set is 88%, and 75% in the nationwide test. So, and we can also provide the positive likelihood ratio of pancreatic cancer according to the number of classification models that predict the case as having pancreatic cancer. So in this nationwide real-world data validation, the accuracy exceeded 90%, and we could achieve sensitivity of 75% nationwide for cancers less than 2 centimeters. And it's important to note that these are unselected real-world images. So it has a variety of imaging protocols, scanners, and even patient factors, various clinical factors are in this validation set. And to put things into context, for such small cancers, we humans can only see approximately 60%. And the device was able to detect half of pancreatic cancers not detected by radiologists. So this is the first computer-aided detection tool for pancreatic cancer, and that has been validated in a nationwide real-world validation. So this paper was published in Radiology and was awarded the RSNA Margulis Award in 2023. So in the press release of RSNA, it highlighted that the work from Taiwan is likely to affect millions of patients throughout the world. So I think so far we have suggested that this device is accurate and generalizable. And now we would like to further deploy it into real clinical settings to help patients and doctors. So we further worked on the usability of the device and sought regulatory approval. Okay. So now this device has been approved by Taiwan FDA, and it is designated as a FDA breakthrough device by US FDA. It uses deep learning and radiomics to determine whether the CT image has pancreatic cancer and indicate the location of the tumor. So to help deployment into various hospitals with different IT environment, we have an iPad-based user interface. So you can see this is red means the case has cancer. And then you double click and then you can see this is the original image. The right side is AI annotated image, positive for pancreatic cancer. And the red dot shows where the cancer is. So a few cases. This is a 72-year-old female with new onset diabetes and elevated CA99 level. A CT scan was performed showing pancreatic atrophy and duct dilation without apparent tumor. An MRI was also done with similar findings. And the AI was positive for pancreatic cancer and indicated a small tumor here. So the patient underwent surgery, turned out to be a 1.5 centimeter stage 1 pancreatic cancer. For the interest time, I think we'll probably skip this. But this case has a diagnosis of pancreatic cancer at this stage, and he had done a previous CT scan which was negative for pancreatic cancer according to radiologist interpretation. And the AI was positive, and AI correctly identified where the tumor subsequently emerged. So we hope that with this system, we can make invisible early pancreatic cancers visible to save patients, to help doctors. So lastly, I would like to thank NTU and NTU Hospital and the National Health Insurance Administration, and also the National Science and Technology Council for their unwavering support. Thank you very much for your attention.